My name is Professor Nikhil Vasdev. I'm a professor of robotic surgery and chair at the University of Hertfordshire, and I'm a consultant urological surgeon, associate medical director at the Eastern North Heart NHS Trust at the Lister Hospital in the UK. I'm the cancer lead for the organization. At the meeting, we are presenting data on the Sunrise 5 clinical trial, which is essentially a phase 3 randomized open label trial, which is for patients who have had intravesical BCG treatment, followed by those patients who have developed a high-grade recurrence. The caveat is that the recurrence must not be associated with concomitant carcinoma in situ. The main objective really arises from the fact that more than 75% of newly diagnosed non-muscle-invasive bladder cancers are confined to the lining of the bladder, whereas 25% of them tend to be confined to the muscle. Between 20 and 46% of patients with high-risk non-muscle-invasive bladder cancer disease will have intravesical BCG, but a lot of these patients will recur. So that is between 1 in 2 to 1 in 4 patients may recur. BCG is not very, very efficient sometimes, and the disease recurrence situation normally stands poised to the patient to either undergo radical treatment, such as a robotic or open cystectomy. But I think this is where the Sunrise clinical trial comes into play. The many patients who are propagated and discuss cystectomy may not want to have a cystectomy done, and largely a lot of patients are elderly and may not be fit enough to undergo major surgery. So, this is quite a difficult unmet cohort where we want to talk about bladder preservation, especially for patients who have localized recurrent non-muscle-invasive bladder cancer, a high-grade post-BCG, and this is where the Sunrise 5 clinical trial comes into play. The uniqueness of this trial really arises from the fact that we randomize into one of the arms, which is TAR-200. This is a target-releasing system designed to allow sustained local release of gemcitabine into the urine via the indwelling bladder. So this is deployed using a flexible cystoscope in the form of a pellet, which sits in the bladder and coats the lining. It contains gemcitabine pellets and tablets that gradually release, largely down to something called the osmotic delivery mechanism over approximately 21 days or 3 weeks, via the pellet staying inside. The drug system is inserted intravesically, as I mentioned, and is changed. The removal of the drug system is done using a flexible cystoscope. The Sunrise 5 trial is a randomized controlled trial, which is basically open label, multi-center. I'm the chief investigator for the trial in the UK to evaluate the efficacy of TAR-200 by the investigator's choice of intravesical therapy, which is normally either Mitomycin C or Gemcitabine in patients who have recurrent papillary-only high-risk non-muscle-invasive bladder cancer, and like I mentioned, with no carcinoma in situ. We have a key endpoint, which is projected in the slide, which I will project to you, but we're looking at disease-free survival, but we're also looking at secondary endpoints of the trial, such as recurrence-free survival, time to next intervention, time to progression, time to disease worsening, overall survival, and safety and tolerability. And obviously, the PROs and the HRO-QLs are being collected. So right now we have 4 centers enrolling patients. The recruitment is going from strength to strength, and we hope to present long-term data to you in due course. So thanks for accepting our abstract for your prestigious conference, and hope all goes well. Thank you.